Have you or any of your family member has lost any newborn baby? Do you know what could be the reason behind that? One such reason is a low blood sugar. Yes. If you don't know about it, then stay tuned with me because we are going to discuss that in our today's topic. Namaste. My name is Dr. Tanvi Mayur Patel. I am an endocrinologist, hormone specialist doctor from Mumbai, India. Today's video is a very special request by many viewers just like you, and it is also a part of my hypoglycemia series. So what is this condition and how common is that and how do we manage it? Which are those newborn babies who are more prone for this problem? We are going to discuss that in our today's topic. So let's begin our video. Now before I continue further, one important information. If you want to watch this video in Hindi language, then on the I button and in the description box there is a link. If you click on that link, then this video will be played in Hindi language for you. अगर आप इस वीडियो को हिंदी भाषा में देखना चाहते हैं तो ऊपर आई बटन पे और नीचे डिस्क्रिप्शन बॉक्स में एक लिंक है. अगर आप उस लिंक पे क्लिक करेंगे तो इस वीडियो को आप हिंदी भाषा में पाएंगे. ओके, सो हाइपोग्लाइसीमिया इन neonates and newborn babies. What is it? So let's understand this by splitting the word. Hypo means less. Glycemia means the blood glucose level in the blood. That means when your blood glucose levels are less than the normal range, we call it as a hypoglycemia. Okay, and when this condition happens in a newborn babies, we call it as a hypoglycemia in newborns. What is a neonate? A neonate is a newborn child whose age is less than 4 weeks. Yes, so any condition which lead into low blood sugar during this first 4 weeks of life, we call it as a hypoglycemia in neonate. Now, this condition is relatively more common in a modern era time. Ideally, every 1,000 live birth, nearly 1 to 3 child has this problem of a hypoglycemia. And this risk increases if you have a many other high risk, and sometimes this risk can even go up to 30%. Nowadays, more and more women are having a diabetes either before pregnancy or during pregnancy, what we call it as a gestation diabetes. Both this condition can increases your chance of having a hypoglycemia in a newborn baby. That's why the prevalence and incidence keeps on rising as we are progressing further. Okay. Now, before I continue this video further, let's understand that what is the normal level of a blood sugar in a newborn babies. See, when the baby is just newly born, within few hours of that life, the blood sugar level is around 36 milligram per deciliter, and as the hours process and the child increases in the duration of life, the blood sugar level are anywhere between 40 to 60 milligram per deciliter. Once the baby crosses 3 days of life, the level increases to around 50 to 90 milligram per deciliter, which is the normal level. Okay, so now let's see what is the hypoglycemia. So see, initially within the 24 hours of a life, if the blood sugar level is less than a 30 milligram per deciliter, we call it as a hypoglycemia. And after 24 hours, if the blood sugar levels are less than 45 milligram per deciliter, again we call this as a hypoglycemia. Okay. Now let's understand what is the importance of a glucose in a child's body. See, glucose is a very important fuel. Now this glucose is a very essential for a very important vital organ like your heart and like that of your brain. So if the child does not have a right balance of the blood glucose, the child will go into hypoglycemia and will have a lot of problems. Now why a child blood sugar will reduce? What is the mechanism behind that? Now see, the first condition wherein this can happen is if the child is not feeding properly. Either this could be in terms of the breastfeeding or it could be in the terms of the formula feeding. Second reason is if the child body does not have a sufficient storage of the glucose in form of a glycogen. Third, if the child has any kind of a health problem which does not allow this glycogen to get converted into glucose, again their blood sugar can be a problem. Or if the child blood sugar level is reducing because of the overactivity or where the child is using more energy, then it is produced, again a low sugar can happen. Or if the child has a high level of the insulin hormone which is causing the blood sugar to fall down, all this can lead into the hypoglycemia. Now this hypoglycemia can happen to any child for that matter. However, this condition happens more commonly to the children who are born in these following conditions. So the first condition is that if during the pregnancy, if the mother does not have a proper nutrition and the mother is a poorly malnourished, again a child is at a risk. And the second and the most common and the most important reason is the diabetes during the pregnancy. It could be either the type 2 diabetes which continued before the pregnancy, or it could be gestation diabetes. Especially if this diabetes is not properly controlled, these children are at a very high risk. Third condition is that if the child and the mother's blood group does not match. Now this is very important, especially that of the Rh blood group mismatch. And this condition we call it as a hemolytic disease of the newborns, and that can also be the reason. Fourth reason is that if the child body has some kind of a pancreatic organ developmental issues or pancreatic or cancers like insulinoma, again these children are at a high risk. Another condition is that of the birth process. If during the birth process, if the child has undergone through a lot of stress, either physical stress, then these children are at more prone, because during that stress the body has utilized large amount of the blood glucose. Many a times the child can have some kind of a liver diseases wherein their glycogen storage can be a problem. Many a times some newborns have some kind of a organ developmental defect. Sometimes they can also have a congenital defect wherein their body has some enzymatic deficiencies or hormonal imbalances which contributes to the hypoglycemia. Hypoglycemia can also happen if the child is born before the due date, what we call it as a preterm babies. If the child weight is more than the required, what we call as a large baby or a macrosomic baby, these children are again at high risk. If during the pregnancy, if the inside the uterus environment was not a good, and due to that the child has gone into a growth problems, what we call it as a intrauterine growth retardation, such children are again at a high risk. If the child is a larger or a smaller than a gestation age, again these kids have a high risk of a hypoglycemia. Hypoglycemia can also happen if the child has a transient hyperinsulinemia. Now, what is this medical condition? Now, transient means for a short term of time. Now, this condition happens more to those newborns whose mother had a diabetes. Now, let me elaborate more in depth about it, because this is one of the most important reason of this hypoglycemia. See, what happens that during the 9 months of the pregnancy, the mother and a child, they were connected with each other by the organ called as a placenta. And during the pregnancy, if the mother's blood sugar was high, that also causes the high blood sugar in the child. So both of them had a high sugar. And the moment the blood sugar goes high to a baby, the body of a child is also working and the pancreas makes a more hormone. So what happens? The child before the delivery has a high level of the blood sugar and a high level of the insulin. Okay, now the delivery happens, we cut the umbilical cord, and now the attachment between the mother and a child, physical attachment, gets detached. Now what has happened? The blood glucose which was coming from the mother to the child, that supply suddenly drops. And what happened to the insulin? Insulin level is still high. So sugar levels are low, insulin level is high, and that condition is called as a transient hyperinsulinemia, and that is the major reason of the hypoglycemia. As this insulin level will start falling down, the hypoglycemic event will also pass off. So these are the major reason why a child will have a hypoglycemia. Okay. Now let's understand what all symptoms can happen to a child. Now see, the symptoms can be absent also. Many a time the symptoms can be very vague and cannot be easily identified, and many times the child doesn't develop any symptoms. So because of that, there is a high possibility that we might miss the diagnosis. However, what are the common symptoms a child can show? A child can have any kind of a shakiness in their body, or they are developing a seizures. Okay, many a times the skin color also changes. Either the skin color is very fade pale color, or their skin color, the lips and all the mucosal linings are turning into blue color, what we call it as a cyanosis. Many a times these children have a breathing problem also. Sometimes they breathe very fast, and sometimes they suddenly stop breathing, what we call it as a apnea. Many a times these children also have a problem of maintaining a body temperature, and their body temperature can fall down, what we call it as a hypothermia, and their body is a very cold to feel. Many a time these children also have a difficulty in feeding. They are not able to take the feed properly. Many times these children have a very flaccid muscle tone, and their muscles are very flabby. Many times the children also look very lethargic, tired, and they don't have much of an energy. So all these symptoms can happen to these newborn babies. Now, as I told you earlier, many symptoms can be missed also. So that's the reason why the moment we know that a child is at a high risk, we pay a very special attention to these children to watch out for such kind of symptoms. Okay. So now let's see how do we diagnose this problem. See, the diagnosis of the hypoglycemia is very simple. Okay. We just need to check the blood sugar. In order to do this, many a times we use a heel stick method, wherein we are going to obtain the blood from the heel of their feet, and we check the blood sugar. Depending on what is the level of the blood sugar, that frequently we do the monitoring. Many times we also do certain other blood tests and some urine test also. So the diagnosis is very simple, and once we know the diagnosis, the treatment falls further. And this treatment and the management is also not very complicated. However, a right attention has to be paid. Now the treatment also depends on what is the overall health of a child. Whether the child overall is healthy or child overall is weak, our treatment will vary. Treatment also depends on what is the age of the child, whether the child is a preterm or whether the child is a full term. Again the treatment varies. Okay. Now, in fact, when we know that the mother is at a high risk, we always give a lot of importance on the immediate breastfeeding. Now, this is a very important point and has to be understood in depth. So, we will discuss in depth about it. So, what happens is that the immediate after the delivery, the breastfeeding has to be started. Now, this point, as it sounds simple, many times it is not that simple, because there are problems from the mother's side and the problem from the newborn baby side. Let's understand the baby's perspective. See, what has happened till 9 months, the fetus was inside the mother's uterus, and this fetus was getting a ready-made glucose directly, and the baby did not do anything. Now what has happened? Delivery has happened, the baby is out. Now it is the same child who has to work for his own blood sugar. Now when I say work, what the baby has to do? Baby has to take the feed. Now either if it is an oral direct feed, it is a simple task for the baby, but when it comes to the breastfeeding, it is a physical effort. Yes, what happens is that when a child sucks the breast, the child has to use the muscle and they literally have to squeeze the milk from the breast, and in doing that there is a lot of effort which a child has to put, and many a times as the child is a newborn baby, the child has not such experience, that many times child gets tired and then this fall asleep, and then they don't get a sufficient amount of the milk and their blood sugar can get fluctuation and they can also fall. So this is one of the major reasons that a child can have a difficulty. Now let's talk about the mother's perspective. Now even it is a new experience for mother might be got tired because of the labor pain and all the energy which body has used, or sometimes if the mother has undergone a cesarean section, there is a pain, there is a discomfort. Either the mother has taken some kind of an anesthesia, there is those effect also, and all this can also have an effect on a breast milk production, and which can reduces the breast milk supply. So this reduced breast milk supply might not be sufficient enough for the child. So that can also be the problem. Okay, many a times there can be a latching issue, and that can also contribute to the poor feeding to the child. Now, besides that, again there are a lot of myths around breastfeeding. Many a times, many women think that the immediate after the birth, the first few milk they should discard and not to give it to the child. Please don't do that, because the first sample of the breast milk has a lot of antibodies and a good nutrients, and this milk is a very highly nutrient which we call it as a colostrum. This nutrient rich milk should not be discarded and has to be given to the child. So many a times we have to break this emotional myths also, and we have to encourage women to instantly start their breast milk. So these are the few points which are problematic when it comes to the freshly milk production and this milk supply. And many a times, yes, there is a problem of the milk production. At that time, of course, we tell the patient that please use some kind of a breast massage, or you can pump so that you can increase your breast milk. So the first mode of a treatment is the immediate feeding to the child. If the child is able to take the breast milk, well and good, we continue doing that. And if the child feels that they are not getting enough milk and the blood sugars are not showing any improvement, in that case we use the glucose. Many times we mix up the glucose with the water and we give that to child. Many times we also give the formula feed to the child. Again, so the feeding is the most important thing. In spite of all this, if the blood sugars don't show any improvement, in that case we might need to use a intravenous glucose, wherein we are going to inject the glucose gradually and slowly. Okay, for this we use a dextrose. So before we start with the slow infusion, we also give a large shot of the glucose at one go, because hypoglycemia treatment is actually an emergency treatment. So many a times we give a dextrose 10% as a bolus dose, and usually this bolus dose is given as a one time, and that we use usually around 2 ml per kg body weight. So if a child or the infant is around 2 kg, we give around 4 ml of the feed. And after that we give a slowly the other feeding, and we also encourage the formula feed and a breastfeeding. If all these measures are not able to increase the blood sugar, in that case, and which happens very rarely, we use a certain other methods in terms of like injecting a glucagon injections, and on a very rare cases we use some surgery wherein we are going to cut the pancreatic organ. However, we need to know the diagnosis first. But these are the certain treatment methods. However, this treatment is easy, but yes, timely treatment is very important. And if we don't do this timely treatment, there can be complications. Now, what are those complications? Now, see, the complications mainly happen because the damage has happened to the brain. So many times the children have a seizures, many times they have a mental retardation, sometimes they even develop a cerebral palsy. Because of the hypoglycemia, many times they can also have a heart problems. So these are the major complications can happen. as I told you that this condition has a very poor prognosis, and many of the time if we don't do the right treatment at the right time, we also lose the child and we have an unexplained loss of a child. Many a time immediate after the delivery, before we got any opportunity to treat, many times the child also we lose it. So this is a very critical stage and very important to treat. Now many people have one question in their mind: how do we prevent this? See, prevention is a very simple. However, all the time we cannot prevent it, because there are many conditions which is beyond our control. However, the most common way to control and prevent this condition is by controlling the blood sugar, which is very important and which is actually very easy. It's not that difficult. Only thing is that you will need to do a right amount of the medical nutrition therapy. You might need to take a insulin as a medication to control your blood sugar. That's it. And we can control your blood sugar. So the moment we control the diabetes in the pregnant women, we can majorly prevent this hypoglycemia in a newborn babies. Many times when we tell the patient that you have to control the blood sugar, you might need to use insulin, people have very lot of preconceived notion and they have lot of other issues going on in their head which prevents them to take a right action, and due to that the result which they have to bear later. So please don't do that. So that's what we saw today. We spoke about what is the hypoglycemia in children, which children are more prone, what are the symptoms, how do we treat it, how do we manage it, how do we prevent it. If you got some good information after watching this video, please click on the like button. If you are new to my channel, please subscribe so that you will get more and more health related information, especially diabetes, thyroid and hormones. And if you have any of your personal question, please leave your question in the comment box. I try to read them as early as I can and answer them also as early as I can. And then there is a bell icon. If you click there, as and when my new video will be published, you will get an instant notification. Thank you for joining me till now, and I hope a great health to you and your future family members as well. Namaste. We will meet again.